11:11 on the digital clock, a perfect time for you to make a wish, okay? As we begin the health brief here on the Journal. It's exclusive and it happens every single Wednesday. So South Africa is currently facing a measles outbreak, and the National Institute for Communicable Diseases, or the NICD as it's known, says children aged 1 and 14 account for the largest population of the laboratory confirmed cases in this national outbreak as you and I speak. So meanwhile, the World Health Organization maintains that the existing approved vaccine is the most effective way to prevent measles on a global scale. To provide us with a brief and an update on this outbreak and to discuss the significance of vaccine-preventable diseases such as measles, we're joined in studio by our favorite SABC News specialist researcher, Zandi Myeza, is back in studio. Isn't it wonderful that we are back home, like where we belong?
It feels good. It feels like where we're supposed to be.
Exactly. So wonderful to see you. So good to see you. Let's talk about, perhaps give us a brief on the latest regarding the measles outbreak right now.
So South Africa is currently facing this measles outbreak, and we've been told by health officials that it's indicative of persisting health challenges in the health system. But the greatest concern has been around vaccine hesitancy and inadequate community engagement around the significance of vaccinating for measles. So measles is a vaccine-preventable disease, which means that you can vaccinate for measles to prevent illness. And what we're seeing in the data, some of the data, not just from the Department of Health, but also from the National Institute for Communicable Diseases, the NICD, is that there's inadequate community engagement. There seems to be a mistrust, low health literacy around vaccinations and immunization, and communities need to better understand why it's important to be proactive, and that's why it's called preventative. That's why it's called vaccine preventative diseases, because you can actually prevent it, but you need the health literacy. You need to equip the communities with the information so that they can make informed decisions about their health and present to health facilities and get immunized. So that's the general overall sense around what has been attributed to some of the concerns around this outbreak. But there's been an increase throughout the country, and the Free State in particular has recorded the highest number of cases. And one of the analysis reports that I went through, the Every Child analysis, is also linked to some of the work the NICD does. It speaks to a broader issue of immunization, not just for measles, but it shows that there has been a decline in immunization uptake between the year 2017 to 2021, but then we saw a slight up trajectory with more people, immunizing or getting vaccinated. So there are changes we're seeing a change. This trend is showing us that there was a low uptake between a particular year, between this year and this year, and then we saw an upward trajectory. So it is indicative that, communities are willing to vaccinate for vaccine-preventable diseases. What else needs to be done so that you can avoid situations where we have community transmission on, diseases that are preventable through immunization and vaccination? Yeah. So it does bring about a broader, discussion around why it's important for people to vaccinate. There are some cases that have been seen amongst 15-year-olds and above in this current outbreak in South Africa. And the NSAD is attributing this to possible immunity gaps. So once again, it speaks to increasing community engagement, increasing health literacy, equipping communities with the information that there are diseases you can prevent. You just need to get immunized. And I think that's the underlining message. Otherwise, you're having a reactive health system where you have to now treat people who now present at hospitals with illness, when you can integrate immunization programs into primary health care and prevent diseases and be proactive in your healthcare service delivery. But communities need to be informed about this, and maybe community health workers and community engagement needs to be strengthened in that sense. Generally, I think that is one of the key things that we are seeing with this particular outbreak, but with immunization issues, around the country and as well as, on the continent.
Right. And just to engage a bit further on matters to do with the experts and how they're getting involved in this discussion, as it were. Health officials are consistently very vocal, and they're talking about the life-saving benefits of vaccinations, particularly regarding vaccine-preventable diseases like the one we're discussing right now, measles. But let's talk about the significance now of this, not just in South Africa. I mean, to other regions as well. But from their point of view, what were you able to gather as to why it is so important to be to spread the message, not just in South Africa, but in other parts of the continent as well?
It's so important that health officials do messaging that is evidence-based and data-driven. And the evidence that we're seeing is that one of the reports, in fact, that were recently released by the World Health Organization's Regional Office for Africa, that did an analysis on immunization programs across the African region, provided a bird's eye view of vaccination, immunization, what are the challenges, what are the issues there. And it really brings the significance around data. Over 500 million children in Africa have been protected through routine immunizations between the year 2000 and 2024. This is what this report is telling us from the WHO Regional Office for Africa. So it's the statistics are informing the messaging that we're seeing from health officials. Right. It also indicates that nearly 20 million measles-related deaths have been averted in Africa since the year 2000. And this has been attributed to an increasing vaccination coverage. The report also tells us that because of this encouraging data, African health ministries are investing more in immunization programs. And the key thing now is that invest the money and integrate these immunization programs into primary health care, and then invest the communication that needs to be sent out to communities as well. Because it's one thing to invest money into a healthcare system where you want to ensure that people get immunized, but you also need to improve the literacy and the messaging around that. So I think those two things need to go hand in hand, and that's where I think we see a lack of synergy. But the report that we're seeing from the WHO Regional Office for Africa on immunization programs shows that it has been encouraging that African nations are investing more on immunization programs. Hence, we're seeing better statistics or encouraging statistics around measles outbreaks in the region. So it's important that the data is what is informing health officials, but also health officials need to ensure that how they use that information, how they use the investment reaches the people who need to be presenting themselves at health facilities across. And these are the factors that need to speak to each health system that is in each African country, and each African country has its own challenges in terms of its healthcare systems. So it's not a one-size blanket approach. Health systems need to look at what are our issues and how do we better immunize people and encourage people to trust vaccines. Yes.
Okay. Well, I mean, the empirical evidence is there, as you mentioned. This is a data-driven, space that we're looking at. But the evidence is clear that vaccination remains the safest and most effective way to prevent measles, and also to protect vulnerable communities and to save lives. That's where we are in this conversation right now. And it's very important as we look at the current measles outbreak that we're seeing on a national level and what is happening with regards to the NICD, I beg your pardon, as well as word from the World Health Organization. We continue our health brief looking at World Population Day after the break.
A legacy isn't a statue or a name carved in a stone. A legacy lives in what people do next. Mandela Month on Channel Africa. The Upside with Poppy Jongwana and Mmatsheko Mosito.
I have one question for you.
Oh, this question that you keep asking.
Would you rather be alone than be unhappy? We have our golden girl. She released a new song, You Won't Be Back. Miss Karen White.
You've been here so many times. We love to have you. What is bringing you back? What are you expecting this time around?
Well, I mean, what's bringing me back is the love. South Africa continues to hold me, and I love it, and I'm thankful. I tell people that you guys chose me, and I don't take it for granted.
It's something we were joking about earlier, that your Sunday only started when Superwoman by Karen White started playing.
I'm so grateful for that because it's such a special honor, to the music, to the legacy, and just to empowerment for women. I love the fact that it's been handed down, and it's a tradition.
The Upside with Mmatsheko Mosito and Poppy Jongwana. Catch it on the Channel Africa app. Weekdays from 3 to 6 Central African Time. The Health Brief on the Channel.
A pleasure to have you join us as we continue our Health Brief Hour. And in studio with me, as per every single Wednesday, where we have these conversations, is Zandi Myeza. She is SABC News Specialist Researcher, I beg your pardon. And we, in this round, are going to be looking at themes of World Population Day. We look ahead at the global commemoration of World Population Day, which it is acknowledged, rather, on a global scale every single year on the 11th of July. So this year it's going to be on a weekend, on a Saturday. All right. And here's an interesting fact, Zandi. The world's population has surpassed 8 billion people.
Yo.
There are 8 billion of us as we speak.
There's many people.
Oh my
on this
goodness.
planet.
But population growth is slowly globally, facing an aging population, if we could put it that way, and declining birth rates rather than a rapid population growth. So I'm trying to reconcile that in my brain. That's why I'm short-circuiting, because it's like there's 8 billion of us, but we're not really having new children. We've got a declining birth population, etc. So there's a lot going on. I'm trying to make sense of it. But let's look at the matters realistically. As I understand it, in 2026, the theme for World Population Day is realizing the hopes and aspirations of young people today and the future. Let's look at that broadly. It sounds noteworthy as an issue, and when we look at global health matters for populations.
The World Population Day is really centered around bringing to the forefront development plans and programs that speak to the very dynamics that you have just shared with us about a growing population and birth rates. And this day is essentially important because then it keeps it in the agenda that these are the dynamics that speak to the population. How do countries, not just in the African region, but globally, how do they actually come up with programs and initiatives that actually address the evolving dynamics of a growing population and an aging population? For example, the growing population, at the heart of the issue for me in particular is the growing population size aligning with the need for an expansion of healthcare services? And, is the left hand doing what is going to assist the right hands, So for me, it's a dynamic there. That's also at the belly of the beast, so to speak, when it comes to a growing population as well as healthcare. But another interesting thing that I think our listeners will really enjoy to hear about, and we will do a interview again on the journal later this week with an expert who can unpack some of the key things in a recent report that we are previewing right now. But the World Population Day this year comes at a time where the United Nations Population Fund has released a survey. Now, this survey involved about over 100,000 young people aged 18 to 39, covering 73 countries. And it was a report looking at what are their interests, this age group, the youth, what are they interested in terms of their partnerships, in terms of as they are growing older. We're speaking about an aging population. We're talking about birth rates, reproductive health, and life aspirations. And what an opportune time to do a survey on life aspirations of young people 18 to 39 as we speak about world population, because the population is growing and they have life aspirations, but are these aligning with development goals?
Yes.
Some of the interesting findings from this report that I thought this is really compelling. Across most regional groups, 2 children is the most commonly reported ideal family size. The larger ideal family sizes are common in West and Central Africa and in East and Southern Africa. So on average, male respondents in these African regions reported a higher ideal number of children compared to their female counterparts. That's an interesting analogy because it's showing us that in West and Central Africa and in East and Southern Africa, 2 children is the most commonly reported ideal family size from the participants of this survey, aged 18 to 39. So, and some of the things that were attributed to this is that there's a lot of uncertainties around the world, conflict, economy, employment, access to reproductive health rights. So these are some of the dynamics that speak to this age group. But I found it quite interesting that ahead of World Population Day, there's this report that's being released looking at what are the life aspirations of young people. And I found that quite compelling. And then we'll make sure here on the journal that we bring in someone who's going to sort of give us bite-sized chunks of what else is in the report and why it matters at a time like this.
I think that is fascinating, and I can't wait for us to delve deeper into it later on in the week. In fact, on the day before World Population Day is acknowledged as Friday, and really talk about also psychologically how young people are looking at, the kind of economy that they're going to inherit in the future, and how that perhaps is playing a role in the decisions that they are making. As you rightfully note, that, young people are also considering the uncertainties that they are currently living under. So that is really interesting information coming through ahead of World Population Day. We continue with the health brief. So in the next half hour, we're going to be looking at the role of science and innovation in advancing indigenous knowledge and health systems. Okay, that's a conversation coming through. Zandi, you are always just so fabulous.
It's always good to be with the journal.
Thank you. Thank you very much. Okay, so here we are wrapping up the first half hour of the journal. We continue with the health brief. I beg your pardon. We continue with that in this next half hour, straight after business news and sports. It's 11:30 right now. Figulele Ngwati, what's new with sports?
Sports.